right, let's get into our first leg of discussion this morning. Primary health centers in Lagos State have been deserted by health workers who complied with the directive to join the joint health workers strike. Yes, and that's also known as JOHESU. All members of the coalition of unions under the joint health sector unions across the 36 states of the Federal Republic of Nigeria and Abuja joined the strike by the midnight of Wednesday, May the 9th, 2018. And some patients who were denied the opportunity to seek health professionals at the different primary health care centers urged the federal government to yield to the demands of the workers.
For a particular treatment she needs to take, we wanted to see doctor because she hasn't been well for a while. So I brought her today to see the doctor, but I was just so surprised to my concern that we were not able to see the doctor. What I was told was that the workers are on strike. There is not even a primary assistant or anything to even render to us, to even attend. Nobody even cares to even attend to us for one reason or the other. Well, what really brought about the strike, I don't know. But what I would just employ the government to do is this. They should just try as much as possible to look into our health sector and provide anything that might bring about the strike or whatsoever. Because a child's care, as far as I'm concerned, is very important.
You know what I'll do, see? I came to the hospital so that my child can be immunized, but I was told health workers are on strike. The government should please answer the health workers. They are offering essential services to us so our children don't fall sick.
And those are the people at the receiving end of this face-off between the federal government and joint health workers. Do you know that the striking workers actually make up 90% of the health sector workers? That's huge. That's huge.
All right, we have in the studio a member of the Senior Staff Association of Universities Teaching Hospital Research Institutes and Associated Institutions, Comrade Adegoke Kende. Good morning.
Good morning.
Comrade.
Good morning.
Good morning. We also have the Chairman, Medical and Health Workers Union of Nigeria, Lagos University Teaching Hospital Chapter, Comrade Adeyinka Adewale. Good morning, comrades.
Good morning.
And it's nice to see you, gentlemen.
It's a pleasure.
Okay, let me start with you, Comrade Adegoke Kende. This strike, Nigerians did not expect this strike to last this long. What is really going on? Let's start from there.
Yeah, let me start from the public. I really feel it when that lady was talking. I mean, that lady that wanted to access Earth's facility and she could not. I really feel it. It's unfortunate. Nobody expect that the action will last this long. But unfortunately, the health sector has been colonized and, what language will I use now, has been taken siege by Nigerian Medical Association. The Minister of Health is doctor, the Minister of State is doctor, even labor, where we are supposed to go when we have issue of disagreement in the workplace is doctor, and they are all working out the script of Nigerian Medical Association. Normally this strike is not supposed to last this long, but because our own minister, we go and sign agreement with Nigerian Medical Association that the moment they adjust the salary structure of JOHESU members, there must be a relativity to their own. And the last time JOHESU salary structure have been adjusted was 2011. And that of NMA has been adjusted 3 times. 2011, 2014, and 2018.
Well, let's get to the facts right.
And when you have many children, you are just taking care of one particular child because you belong to the same health confraternity. It's not fair. You can't have up to about 13 children. You are just treating one as king and you are treating others as if they are nobody.
Is that what is at the core of this? Because we do recall that when JOHESU threatened to go on strike and made all these demands that they have made over time, the NMA actually said that government should not accede to your demands. So is your quarrel with the NMA and, of course, Isaac Adewale, Dr. Isaac Adewale, the health minister, or is it really about the conditions of service, poor remuneration, and all the other things that you've been asking for, consolidated health, salary structure, CONHES, implementation of court judgments, upward review of retirement age from 60 to 65, and all that? What exactly is at the core of this?
They actually go pari passu.
Okay.
But unfortunately, this action is being prolonged because Professor Adewale, the minister, is acting now the script of Nigerian Medical Association where he belongs. The, 2010, 2011, NMA was making move to see to how other health professional and health workers in the health sector, their services can be privatized so that they will be the one controlling everybody. And each time they are talking, they always talk about international best practices. And since this action started, we have brought out what are the international best practices. The health service is a teamwork. No singular profession can render health service unless that person is going to be a quack, because it's not like the traditional medicine where one man is the one who does the diagnosis, is the one who does the treatment, is the one who does the other investigations.
All right, let me bring Comrade Adewale in here. Yeah. If you look at the demands, they all seem as though it is all about us, our welfare, our salary structure, our condition, our retirement benefits, our retirement age limits, and all of that. A lot of Nigerians see this as really very self-centered and selfish. What would you say?
Thank you very much. Sincerely, the demands of health workers has been on for many years. And we keep on repeating same thing, year in, year out. But for only God knows what reason, demands of health workers has not been met satisfactorily. Because the people that are actually at the helm of affairs, controlling, the leadership of health industry, are all doctors. So there are actually no one that will represent the interest of non-doctors. And there is a Yoruba adage that says that one kin faori leyin olori. Your hair cannot be shaven in your absence.
I think that's an African proverb. Go ahead.
So, like many agreements that have been made, JOESU members were not, or let me say other health workers were not well represented. They are not even being represented at all. So concerning the infrastructures, that one has already been taken care of by policies.
When you say it's been taken care of, in what sense?
This is what I mean.
Okay.
Like you have a facility, and there are things you need to work with in that facility. Yeah. That has been okay. For this, your job, these are the equipment you need. And you are a worker. It is the duty of the employer to provide what you need to work with.
So when you say they've been taken care of, are you saying there's adequate infrastructure in health?
What I mean is this. The fact that it is not provided yet does not mean that there is no need for its provision.
No.
Okay, you're almost confusing
hang on. Let's we need to, people are watching. No, hang on. People are watching and they need to get clarification on what's going on.
Let me put
the
it this
state
way.
of the hospitals, the infrastructure in the hospitals, equipment to work with is one thing Nigerians have issues with. But so when you say they have been taken care of, precisely how do you mean so that they can understand?
There have been demands for them. Government is aware that, okay, for me to work optimally, to deliver, I need these and these equipment to work with. Like, you are my employer now. You want me to deliver. And I've already told you, for me to deliver,
these are the tools that I need.
These are the tools I need to work with.
In other words, what you're saying is...
What it means by taking care of is that all of these have gone to government, and they are already saying they are going to do this, do this, do this. They are going to do a number of things. But other
have they done any of those things in terms of infrastructure?
You know, the number of hospitals, they have not been able to go around, and a number of them, some private investors have come in one way or the other. Okay. But there are still many that are yet to be taken care of.
But what you're saying is that government has demonstrated that it is willing, ready, and able to
are yet to see
do the right thing as far as infrastructure is concerned.
We are yet to see good enough responses.
Okay.
Yeah.
Is it that you're not...
In that case, how is it taken care of?
When you say taken care of, like some initiative by some private investors are willing to bring in equipment, and the government employ human hands are there to operate those equipment.
So in other words, even the equipment is not necessarily coming from government.
But when we say some of them are being taken care of, is on this aspect of PPP.
All right.
Some individuals are bringing them, and we are there to work with them. We are hopeful that some of them will come.
But there are other things that have not been taken care of. Professor Isaac Adewale, the health minister, said recently that government has met health workers halfway in terms of salary, some of the demands that you have made. But there seems to be a tendency to want to use blackmail to get government to provide all of the things that you've asked for.
Let me tell you, the truth, I've said it before. The minister just wants this action to prolong so that JSU will look as though we don't have human feeling.
To lose public sympathy?
We don't have public sympathy, and then they've been propagating that other health professionals and workers should be privatized so that they can go behind the door to buy the system.
What I'm hearing from what you gentlemen are saying is that it's actually the NMA, the doctors that are working against, working against your interest.
With the leadership,
and it doesn't matter how it
minister.
affects the public. Nigerians who are dying, who are not getting access to healthcare and all of that.
With the collaboration of the Minister of Health and Labor, they are working it together. The truth is that what we are when we say the number one issue is adjustment of the salary. I told you that of Dr. Wish's comments was adjusted 2011, 2014, 2018. It's not fair. We are in the same industry. We have never taken the same thing. As far back as before 1991, when Olukoye was there as Secretary of Health with Babangida's government for 8 years. They introduced medical salary structure. Before then, everybody used to be on the same entry point, and then with difference instead based on duration of training. That's Ministry of Establishment decide that after job evaluation. But when they introduced medical salary structure, the salary of doctor became almost triple of other health professionals. And you just have 1 year difference in training. Like medical lab scientists train 5 years with 1 year internship. They do 6 years with 1 year internship, which they call housemanship. Is 1 year different enough to create triple remuneration? I mean, it's not fair. And this thing was addressed during Obasanjo's time. They created CONTES, consolidated salary structure for everybody. Everybody, whether doctor, nurse, pharmacist, everybody was on that structure. And the basic was the same, and then the relativity was arranged in terms of allowances, like core duty allowance. When doctors get 4% of their basic, others get 2%, 1.8, 1.6, depending on duration of training. So we are not asking for equality. What we are not asking for parity. What we are asking for is fair play, justice.
Equity.
Equity, thank you. So They are making us to look as if we are saying we are asking for exactly the same thing they pay doctors. Meanwhile, what they pay doctor has been adjusted 3 times.
Okay, let's even get into the numbers or the figures in here so Nigerians can have a clearer idea. What is when it comes to the ideals and when it comes to mentioning the numbers, what is the average take-home pay of a doctor that we have been having issues with? Let me ask you, Comrade Adeyinka.
Thank you very much. Concerning the take-home of the doctors, the present adjustment that has been done for them. That's it.
Okay. You talk of nothing less than 300 and something for the least paid doctor. That is
300 and something what?
Thousand naira.
Okay.
You are talking of the least paid. That is
the
intern, who is still in training, who has not even gone for NYSC.
That's a monthly salary of
an average doctor
in the public sector
in
in
the
Nigeria.
public sector. Yeah.
Would you,
and then when you talk about
you in all fairness, say that even that figure is good enough, for a medical doctor who goes through how many? Is it 7 years? Then housemanship and all of that.
6 years.
Some branch off to different areas of
6 years.
But I also go through 5 years and 1 year internship, 6 years. Then when you add NYSC to it, 7. So is it fair? Is 1 year different in duration of training fair enough for like
is it the duration of training that makes you equal to the medical doctor, or the quality, or what the training, the essence of the training itself?
Look at the curriculum.
Okay.
Look at the curriculum of the various professional group and see the quality of training. The curriculums are dense. The quality of training are dense. Are quality. And yet, because somebody has spent just 1 year different, everybody studied virtually the same thing the first 2 years. It's at the 3rd year that you now begin to face your various. Everybody used to be in the same class.
All right,
and you will see people who are not even studying medicine beating down those who are studying medicine.
Let's not lose track of, because you said medical doctors take 300 and something. So what's the difference between the least? Well, we're just talking about the average. So how about the other health workers? What's the difference now, so we can picture what is there, have an idea of what this thing is?
If you want to talk about because it's fair to compare interns with interns. House officers are interns. And interns in the health profession, they come in because they come in at Commerce 1, that is on the Commerce for the doctor, which is equivalent of Commerce 12, Commerce 9 presently.
That's the consolidated health salary structure.
Yeah. So that is for JOESU, where the Medis they come in Commerce 1, which is equivalent of Commerce 9.
How much do they take?
And for us, our interns, that's the interns like dietitians and the nurses, currently they come in on Commerce 7, and their take home is less than 100,000. So when somebody spends 5 years, another person spends 6 years, and then they are both doing internship. Somebody is going home with 300 plus, another person is going home with less than 100,000. Is it fair?
When you say less than 100,000, in what range? Between 70,000 or 90,000, or it is 80,000 or 95,000?
About 90-something thousand.
90-something thousand. So we have about 300 and something thousand for medical doctors, and we have about, let's say, average of 95,000 for health workers.
That's the least
These
paid
are
interns.
Who are just
and both of them are interns.
Good. All of them are interns.
Who are still under training.
Who are still under training.
Yeah.
All right. This is not to reduce the place that the
health workers
occupy in the country. But
that is because it has been adjusted 3 times.
Okay. But we also know that the minimum wage in Nigeria is 18,000 by law. That's not to say it is adequate by any means. So when people who earn about 18,000 or 20,000 or 30,000, as the case may be, are sick and they want to come to the hospitals to get medical check and all of that, and then persons who earn between 95,000 and 300 or 400,000 are fighting based on ego, and then deny somebody who's taking about 25,000 or 18,000 naira home basic health care. Wouldn't Nigerians see it as ego play and selfishness?
And is this not why we continue to be in this vicious cycle?
Yeah, it's a pity. You see,
I'd like Comrade Adeyinka to say something about this.
Yeah, thank you very much. You see, I don't know actually how the NMA is seeing it or how the minister is seeing this issue. Why they are finding it difficult to do unto others as they actually want others to do unto them. Their own have been adjusted. Same should be done to the constable. We are not actually asking for too much. And we should not even be here. This strike should not even have
happened in the first place.
Into play at the first. Because there was an agreement. The agreement said, okay, we agree, we adjust it.
Did government give you any definite figures as to what adjustment they would make, especially as it pertains to this disparity between, not necessarily disparity, but the regularity of upward review of the doctors' take-home and that of the health workers? Did government give you any definite figures?
Well, as at now, as at present, a table has been presented, which the US leadership are studying. But we have heard the minister saying that before independence, health workers and doctors never take same thing. And after independence, that doctors are still earning more than health workers. That even he will do everything not to allow health workers and doctors take same thing. Meaning that he will always do everything to block the health workers and put them to be underpaid, as I wish want to put it.
To be underpaid or to be paid what they deserve. Maybe the problem seems to be that...
This is how we are seeing it. This is how we are seeing it.
Let me help out this.
But we don't have all the time. We don't have all the time. No, before you go on, let me ask you so you can answer this question, Comrade Adegoke. How much are you requesting now that will make Johestu members or other health workers say, okay, fine, this is fair? How much is fair to you?
Well, I can't say directly that this is how much that is fair, but the tables are there. There is a meeting today between Johestu and government. Okay. And government has presented a particular table. They have studied it. They are going to meet today. And
can you let us into what government has put forward?
Well, I don't have
it. You don't have it.
I don't have it. The people at the negotiation table are over there. So, and what I know is that we are not asking for equality. We are not asking for the same thing.
Yes,
what we are asking for is fair play. We are asking for justice. We are asking that whatever is given, at least it has been a particular way and there has been peace. Prior to 1991, when medical salary structure was just introduced from nowhere. And when Obasanjo came, he corrected this thing. And after Obasanjo left, during Jonathan's time, Professor Onyebuchi came and took us back to what was creating problem. And since then, we've been pressing this thing. But we have not been attended to. But their own colleagues have been attended to 3 times. It's not fair. Within 2 weeks, when they started their struggle, they attended to them.
Okay, so what's the way forward now? What's the way forward now? What assurances can you give to Nigerians that indeed you are truly sympathetic of their situation? Because you said earlier when we played that report that you really feel bad for those who don't have access to healthcare. So what comfort are you going to give them right now that you're willing to meet government halfway, if not, you know, totally? Comrade Adeyinka?
If the government do the needful today, health workers will be back to work immediately. And also, what DRESU is demanding is very simple.
Yeah.
Give us the same basic. Let our allowances make the difference.
Okay.
If I am on Cohens 9, let my basic be the same with whosoever that is on Cohens 9. And if you are a medical doctor, let your allowances be peculiar to you. And if I am a pharmacist, let my allowance be peculiar to me. You can earn more than me on your allowances. It is based on what I've been employed for.
Gentlemen, we have to leave you here right now. The time is against us. Comrade Adinka Dewale, the Chairman, Nigeria and Health Workers Union of Nigeria, Luth Branch, thank you very much for coming.
Thank you.
And Comrade Adegoke Kehinde, the member of the I think I've written. Member Health Senior Staff Association of Nigeria, of Universities, Teaching Hospitals, Research Institute, and associated institutions.
It truly is a mouthful.
It's
so
a mouthful.
Understandable that one would.
Well, thank you very much, gentlemen, for coming.
Yeah, thank you very much.
Thank you so much.
We do hope that you get what you want at the end of the day, so that Nigerians don't suffer.
Thank you.
All right.